Ever worry that you may start feeling like you're spinning out of control, especially in challenging situations like driving, working, or caring for your child? That situation. I want you to know you're not alone, and there is hope. I personally suffered from dizziness not that long ago, and I truly understand what you're going through. In this video, I'll guide you through proven tips and strategies designed to help you regain control and stay grounded no matter where dizziness finds you. Plus, make sure to watch until the end, as I'll reveal a little-known treatment that not only effectively gets rid of dizziness permanently, but also targets a frequently overlooked neck-related cause. Don't skip this part of the video. It might just be the key to achieving long-term relief from your dizziness. Hi, I'm Dr. Joshua Gelber. I'm a chiropractor in the Annex area of Toronto, Ontario, Canada. We focus on helping people overcome headaches, dizziness, vertigo, neck, shoulder, and back issues through specific chiropractic spinal correction techniques. But before I dive in, I need you to smash that subscribe button if you want to learn more tips and strategies on how to get immediate and lasting relief from these conditions. Let's be real. Dealing with dizziness can be scary and confusing, especially in situations that are part of our daily lives. Imagine feeling dizzy and anxious every time you leave your house to drive, especially on fast roads, the highways with lots of turns and traffic. Then think about being at work or sitting in meetings or at your desk. Makes you feel so unsteady that you're really afraid, you're going to fall off your chair. For parents, the worry doubles when you're taking care of your kids, scared you might get dizzy while holding them. It's a real challenge that many people face, trying to manage these fears and keep safe. In this video, I'll show you how to spot the early signs of dizziness, create a safer environment, and develop backup plans. These strategies, in my opinion, they're crucial for anyone trying to manage dizziness in daily activities, helping to ensure your safety and the safety of those around you. Let's dive into practical tips and advice to tackle these challenges head on. For each of driving, working, and caring for your child, I'll share 2 coping strategies for managing dizziness in each situation. Driving. First suggestion, plan your routes to include frequent rest stops or safe places where you can pull over if you start feeling dizzy. This gives you a chance to pause until the dizziness subsides. For longer trips, don't drive alone. Consider having a companion who can share the driving responsibilities, really ensuring you're not behind the wheel when feeling unwell. Worst case, someone who can grab the steering wheel in an emergency if you're driving and the dizziness kicks in until you can pull over. Second tip, use a GPS with voice commands to minimize the need to look down or away from the road. It can really help reduce the risk of dizziness triggered by motion or focusing on close objects, that motion. It allows you to keep your eyes on the road and reduces the cognitive load of all that shifting, potentially decreasing the likelihood of dizziness while driving. Second one, working. Request or create a more ergonomic workspace that reduces strain on your neck and eyes. I have this conversation all the time. They're common triggers for dizziness. It can include an adjustable chair, having your monitor at the right eye level, and proper lighting that reduces glare. I speak about this every day with my patients to make sure they're in the right set. Many bad setups and postures can cause more head and neck strain, more than people realize, especially while being distracted by that big blue light. Reducing physical stressors in your work environment can really help manage symptoms and maintain productivity. If dizziness strikes during meetings, take frequent breaks to change your posture. This may help mitigate the onset of symptoms. Additionally, really and truly inform a trusted colleague about your condition so they can assist or cover for you temporarily if needed. Arrange for a more flexible work schedule or the option to work from home, as it's far more common now for most. It can be a game changer, especially and particularly on challenging days. Second tip, another highly effective dizziness coping strategy at work is to utilize brief, mindful meditation or deep breathing exercises throughout the day. This approach can help manage stress levels, which are often a trigger for dizziness episodes. You notice I'm tranquilizing. If you feel less stable by closing your eyes and reopening them, pick a target to focus on further away and do the same breathing and centering plan with less risk of the room spinning when you close and then reopen your eyes. By dedicating a few minutes multiple times a day to close your eyes or focus on your breathing, center yourself, you can significantly reduce tension. It's a trigger. And this not only helps in preventing the onset of dizziness, but also improves, overall well-being and focus. Incorporating these short relaxation sessions into your daily routine can be a simple yet powerful tool to combat dizziness at work. Caring for children. When dizziness is a concern, engage in activities with your child that allow you to remain seated or stationary, minimizing the risk of falls or accidents. Keep your essential items within arm's reach to avoid sudden movements or rushing away that could trigger dizziness. It's also helpful to explain your condition to older children, in simple terms so they can understand and assist in such times of need. Fetching items nearby or just playing quietly in and around. Develop a network of support with family, friends, neighbors who can step in when you're feeling dizzy. Having someone to call on for help with childcare duties during severe dizzy spells can ensure your children's needs are met while you take the time to recover. Take it from a busy parent, put some time into yourself. Additionally, preparing activities that children can do independently or with minimal supervision can keep them engaged while you're nearby and still allow you to rest. Each of these strategies focuses on minimizing risk and ensuring safety while managing dizziness in these challenging situations in the car, at work, and with kids. Adapting your environment and daily routines to accommodate your dizziness symptoms can truly help maintain your quality of life. Remember, consulting with a healthcare professional for personalized advice and treatment, it's crucial in managing dizziness effectively. Now, I'm going to share with you an often missed cause of dizziness, and a little known, yet highly effective way to treat it, or permanent relief. As I've spoken about, dizziness is often associated with poor neck posture, neck muscle weakness and imbalances, which create postural and proprioceptive distortions and disruptions. And that's why spinal correction-based chiropractic adjustments may play a significant role in correcting these issues, acting as a crucial but lesser known method for treating dizziness. By realigning the spine and addressing subluxations, chiropractors help restore proper nerve function, potentially alleviating symptoms of dizziness in lots of cases. If you're grappling with this issue, strongly consider having your neck and spine evaluated by a chiropractor in your area. Look for or ask for someone who specializes in the analysis and correction of vertebral subluxations, otherwise known as spinal neural misalignments, as they can provide valuable insights and potential solutions for your dizziness. I hope you found this video valuable. If you did, go ahead and like and really share the video. This will also help get this message out to more people who are suffering from dizziness, giving them reassurance and tips to handle these challenging situations. Thank you. Now I want to hear from you. Share your story of how dizziness is or has affected your life. In particular, share if you've had dizziness come on while driving, at work, whether it's office-based or factory-based or whatever, or while caring for your child. Let us know how you handled it. What worked, what didn't work. Comment below, let us know. Remember, subscribe to get more tips and strategies on how to live and function well. And if you want additional exercises that you can do at home to help get rid of dizziness, the video you should watch next, it's this one. It'll show you a series of exercises that are proven to relieve and get rid of dizziness caused from neck problems. Watch this video